So with this, we're going to have it like this. You kind of roll it up, drop this whole area, make sure it's not dropped on their head at all. And then you're going to hold this area and this area. And then you're just going to pull it down like this. And then you're going to pull this up like this. And then you can lift up the arms. Okay, so that will expose the abdominal region. Okay, with the abdominal region, you can perform like regular Swedish massage in this area. But again, make sure they're not high risk, and if they are, get permission. And you're not going to be pushing on the baby, of course. But the pregnant woman is going to use a lot more pressure than you're going to use. Believe me, I guarantee it, because sometimes with the baby, it might be kicking up in the ribs. They're going to push it down and stuff. But again, us as massage therapists, we're not going to be performing those kind of techniques. And the majority of the times, the baby's going to actually go to sleep during this time. You'd think it might be awake, but it would actually go to sleep the majority of the times when you're massaging the abdominal region. So we're going to start with some clockwise position, like this. Just nice and calming. And sometimes you can feel the outline of the baby. And if you want, you can ask the pregnant woman where the head is. Where's the head at right now? Right down here? Mm-hmm. Okay. So I can kind of feel the outline of the baby right now, right in this area. So the baby's already dropped. And she has about 1 more month, and then that's when her due date is. And then this is actually her first, who will be her first baby too. And in general, I mean, every single pregnancy is going to be different for everybody. But in general, sometimes the first baby tends to go a little bit longer. So they might go longer than the regular time allowed. Then we can even go underneath a little bit, kind of just pull it up a little bit. And sometimes it's a little bit harder on our backs, so we can ask permission if we need to. Just put our knee up on the table a little bit to give us a little bit of a break when we're working over a large abdominal region like this then. And right at the diaphragm, right at the xiphoid process right here, a little bit lower, you can just compress a little bit and kind of do a little rocking. Because the problem is with the average pregnant woman, they're not breathing from this area too much. And it's totally understandable just because, again, the baby's pushing up in that region. But when the pregnant woman, when the baby actually drops, it's usually around a month or so before they're ready to give birth, that's when they start breathing better, but that's when they start urinating a lot more, and they typically get a lot more hungry too during this time. So the last month or so of the pregnancy, that's when they might gain a little bit more weight, but they're going to be urinating a lot more, and they might breathe a little bit better too, because again, the baby's going to drop more, so it opens up the diaphragm region then. And you can even perform some breathing techniques with them. Just have them breathe into your hand, and then when they breathe out, just compress it just a little bit. You're just reminding them to breathe is what you're trying to do from this region. And when they breathe in through their nose and out through their nose, it's more calming. They're not going to hyperventilate that way. Okay. And sometimes you might be able to feel a pulse in this region. So the inferior vena cava right here. So again, you're not going to be pushing on the pulse region. But if a pregnant woman, if they ever feel uncomfortable at all, sometimes they just need their right hip elevated a little bit. So it offsets the inferior vena cava is what it does then. If you put something underneath that right hip a little bit, and if you need a little bit extra time in this kind of position then. And you can even do some circular friction right around the colon area. You can use your knuckles a little bit if you need to. And you can put their hand right here and you can go underneath their lower back. So basically what I'm doing is I'm going underneath their lower back, and you can use your knuckles in that area. And the baby's more floating too in this position, and just try not to push up, of course, in that position. So let's go to the other side and just show you what I was doing. So again, you go underneath like this, use your knuckles. And with the body cushion, sometimes your hands can slide underneath there really easy too. You can use your knuckles again, or just your flat palm. And if you need to stabilize everything, you can just place your hand on the abdominal region and just kind of go underneath there. You can even do a little petrissage and a pinch, but not total pinch, of course. And I'll go back to the other side. Next one, you can kind of just give a little pull. And when their arms are on their diaphragm region like this, it makes it a little bit easier, because when you're leaning over, you don't want to be leaning over on their hands, of course. And right on the navel area, you can just kind of do a little rock if you want. But just nice and relaxing, of course. The slower the better. So if you think you're going too fast, just slow it down. And if you want, you can perform a little bit of development, but just really light. Again, you can go underneath both and just give a little pull up. So again, both of them are going underneath and we're pulling up. And if you want, you can kind of rock it out too. So both of them are kind of rocking out. Or you can go like an ocean wave back and forth. And when you're finishing in the abdominal region, you can just kind of slow it down. And the average pregnant woman is going to usually have no problem with you massaging the abdominal area. But again, it's always a good idea just to ask permission, of course. You just slowly stop it. And then whatever areas that you're not massaging, of course, you want to make sure you cover them up. And then when you're going to take out the breast drape, just make sure you just pull this out a little bit like this. Then you can cover them up like this. And then again, pull it out on this side. And I'm going to hold on this side. Then just pull it out then. Now we'll go to the lungs.